Hello dear OET aspirants, I'm Dr. Arshnoor from Dr. Arshnoor Institute. Welcome to my channel. In this channel, I am giving solution for OET writing and OET speaking to help you to get better score in your OET exam. So today I am going to give you a solution for a very important role play. It will help you to solve many other role plays like that, because this is lifestyle modification. In the lifestyle modification, there are number of topics which are coming. For example, it may be topic related to weight loss, diabetes, hypertension, cardiac problem, anything else, high cholesterol. So this role play is going to help you in many other role plays also. So first of all, we all know that we have 3 minutes prior the role play to prepare the task. So now it is important for you first of all to read the task thoroughly and make notes properly. Then start. Before starting any role play, keep this thing in your mind that every role play has 3 parts. That is, first is greet the patient. So it is important again that greet the patient according to the setup. If it is a hospital, then it will be different. If it is a community center, then it will be different. If it is an emergency. So the similar way you have to make your greeting. Second is to gather information. It's very, very important part here. Then third is to give information or to give advice to the patient. What happens usually, students start giving information immediately. They gather some of the important information from the patient, but they lack to fulfill the complete task because they are left in between. The task will be finished within 1 minute, 2 minutes or 3 minutes maximum. Whereas we have to take the task up to 5 minutes, because this is important for you to linger on or to exaggerate the task up to 5 minutes with important information and following all the parameters given to you. The checking criteria and assessment, how your scores will be given to you, how you will be graded. I'm making a complete video for that, and this will be put in the YouTube within few days. You can check that and that will help you a lot. But today I'm just going to have this role play, which is again I'm telling you very important. So must go through the complete role play so that you should be properly benefited. In such topics, I'm giving you a formula, a format which will help you a lot while gathering information. Must start by the occupation. So we'll be having 3 to 4 type of the questions in beginning to ask the patient. First will be, according to me, that will be occupation. So you may start with this, that what do you do for your living? This is important to address the patient by the name instead of ma'am or sir. You should address the patient directly by the name. Now in this case, you may, so let's have this patient with the name Johns. So you may say that how would you like to be addressed, and how may I address you, what is your full name. Then you may move forward. See students, in this case there are chances that the doctor has already given you the details regarding the patient. So when you start this, start with a greeting, good morning, good afternoon, hi or hello, or then I am your attending nurse today, or I will be attending you today. And Dr. David has told me about you that you often feel tired, low and unenergetic. Along with that, you are hypertensive. See, now this patient has a busy schedule being a lawyer, And as I told you that when you start with the occupation, so this will be fulfilled. That is working for long working hours. It is for 10 hours, 12 hours or whatsoever may be. Then, but he is unaware about the high BP or the consequences of that. So you have to ask the questions related to that, like his occupation, diet, sleep, exercise, stress, smoke. The same formula will be applied in many other role plays. So must see the video till end. In this case, you may add one thing more to fulfill the task, that is, may assume or pretend that may I take your BP? Then after a pause, say yes, it is 160/90. It is elevated. Now go to the rest of the task. Let's start the role play. This patient is referred to you by the doctor to give advice on lifestyle modification. Most of the information is given in your card. According to that, you can prepare your role play. Your questions and answers can be prepared accordingly. First part is obviously to greet the patient. So let's start with this. Good morning or good afternoon or hello or hi. You may greet the patient or wish the patient the way you want. Then the next question can be, how may I help you or how may I address you? According to me, I feel that it is better that whenever you are meeting the patient first time, you should first give your introduction that good morning, I am dash and dash, one of the registered nurses working in this hospital. How may I help you? Then you may ask the name of the patient. It could be in the form that what is your name or how would you like to be addressed or how should I address you? Then obviously, as this patient is referred to you by the doctor, you already have the information about this patient. So you can say, oh yes, Dr. Ravi told me about you. Then after seeing his reports, you can directly come to your role play. Then you should start. Before I could help you in a better way, I would like to gather some information about you. If you are comfortable, may I ask you some questions? Then you may proceed further. So what I feel in the lifestyle modification, when there is an adult patient, obviously most of the problems are due to the occupation for long working hours. So I would suggest you that you should start from the occupation. So you may start that, what do you do for your living? This is the best formula which I'm giving you right now, which will help you to prepare many role plays afterwards. So when you are starting with the occupation, there will be 3 to 4 questions related to that. Then it will be diet, because these are the two major segments where we have to work, ask the questions properly and advise the patient accordingly. Then it will be about exercise, then about smoke, then alcohol, and even sleep too, if the patient is sleeping. And one thing very, very important, do not forget to ask about stress also. Now, let's start how it is to be done. You must ask the patient, what do you do for your living? Then patient may say that I'm working as a computer operator, I'm working as a mechanic, I'm working. Usually, these type of the patients have sedentary lifestyle. They have the sitting job. It may be teacher, it may be a computer operator, it may be receptionist, it may be a person who's working on the desk. This means the patient is not moving, not having some job in which he has to exert himself by doing some physical work. Then you may ask another question that is also related to the occupation. How many hours do you invest at your workplace? Then the third question related to his job will be, is your job stressful? Sometimes a patient may say that, yes, I have to work for more than 10 hours. My job is very stressful. Then you will be having a very important point while giving advice to the patient. According to that, you can give advice afterwards. So see students, do not try to give advice simultaneously. So just gather the complete information first, then give the advice at the end. Now let's start with the diet. What type of food do you like to take, or what type of food do you prefer to eat? Patient may say that I do not have much time to prepare food at home, so usually my food is from outside. Then you can say, oh, I can see, but it is important that you should give some of the expressions here. Then next question could be, would you like to eat non-vegetarian diet or vegetarian diet? Because again, you will be having some points to give the patient. Then next question, how many meals do you take? If the patient says that I am taking 2 meals, this means he is having long fasting. Then you may add that, do you take snacks in between? What type of snacks do you take? We know that snacks are often fried or roasted, which are playing significant role here to make the patient sick for being diabetic, hypertensive, obese, or any other problem with the high cholesterol. So then you may give advice accordingly. Then the next question can be about exercise, his sleep. Do you do exercise? How many hours in a week do you exercise? Then how many hours do you sleep? Do you have sound sleep? Then now, when asking about smoking or alcohol, because this is something personal, patient may get annoyed. Here you may get the permission from the patient. Do not ask these questions directly. You may say, suppose the name of the patient is Johns. So Johns, if you don't mind, may I ask you some personal questions? Do you smoke? Then he says that, yes, I do smoke. Then you may say that, how many cigarettes do you smoke? Then may say that it is 15 to 20 cigarettes, or it may be 20 to 30 cigarettes. The topic is particularly about the patient who smokes heavily. Then you just say, oh, it's too much. Don't use any odd language to tell the patient that he's smoking overly or he's smoking heavily. Then it may be about alcohol. See students, alcohol consumption and smoking in somewhere acceptable in some of the cultures, but in some of the cultures it is not acceptable. So here you cannot make a hard and fast criteria to tell the patient that he is smoking heavily or he is smoking too much, or it is very bad, it is injurious to the health, or something like that. And similar in the case of the alcohol consumption. Alcohol consumption is considered as a ceremony or a good thing in some of the culture, and somewhere it is required. Even in some cold climatic areas it is required. So the people don't feel bad about taking this. But wheresoever the concern of a smoke is, obviously we know that is smoking is injurious to the health, and in such type of the topic we have to convince a patient to cessate smoking, go for smoking cessation. Now I'm going to answer the questions in the form of the advice. So I'll start with this. Mr. Johns, I can see that first of all you are working over hourly, as you're working for more than 10 hours, and I guess this is a major cause of all the problems you're facing right now. What is my suggestion? That you should reduce your working hour. The patient may say that, oh, it's not possible for me because my boss is not supporting and he will not allow me to reduce my working hours, then you may give him the suggestion that you may reduce your working hours, which may reduce your income also. Then otherwise you can give him solution that you may change your job, because health should be the priority. You should not do anything on the cost of your health. Then second is about diet. As a patient is usually taking food from outside, you need to say that, Mr. Jones, I can see that most of the food you're taking that is from outside. Am I right? Must make the patient involved in your conversation. Do not go with the direct dialogue or some speech to be delivered to the patient. She must involve the patient in between. So he says, yes, I'm taking most of the food from outside because I don't have much time to prepare food at home. And then you should add, so along with that, you are taking most of the food that is fried and roasted. Is it so? Again, the patient, yes, you're right. Then you should say that it is essential for you. Now, you should go with some of the synonyms, as we know that important word is overly used, or it is used at many places. You may use the word imperative, pivotal, vital, crucial, significant, considerable. You can use these synonyms instead of important everywhere. Then you should say that it is imperative for you to eat homemade food. Patient says that it is not possible for me because I'm living alone, cannot prepare food at home, I don't know how to cook food. Then you should say, okay, fine, Mr. Jones, then when you are ordering the food outside, instead of ordering snacks, fried, oily food, you should switch on to or replace your food by steamed and boiled food. Can you do that? He'll say, oh, yes, I can do. In that case, you are involving the patient with you. Then along with that, you can say that it will be preferable if you add salads, fruits in your diet instead of going with the snacks every time. So, will you be able to do that? Again, involving the patient will give you his assurance, yes, I can do that. Then you will definitely find some changes in your health afterwards, after you do all these. Then the next question, as we have asked the patient about exercise, then you should say that, Mr. Jones, what I feel that you're not doing exercise, but it is important for you at this time to start doing exercise. I don't ask you to go for the strenuous exercises. I don't ask you to go to the gym or do some exercises like cycling or something by which you will be exerted. You can simply start with deep breathing exercises. You may start with jogging, walking, or in between your job hours, you should sit. You should get up from your chair and have a round in your office. Instead of using elevators and lift, you should prefer to go by stairs. If your office is not far away from home, instead of using your vehicle, you should go on foot. So even by this, it will help you a lot. Then, now the most sensitive part comes, that is about cigarette smoking. So, Mr. Jones, now I'm coming to the most crucial point in your case history. As you told me that you're smoking 10 to 12 cigarettes or 15 to 20 cigarettes, any number the patient says, this is the most triggering factor for your ill health. It has become mandatory for you to quit smoking immediately. So, smoking cessation is another topic I'll cover that in some another role play, so you can go with that complete. Smoking cessation, I'm giving some solutions for the nicotine patches, nicotine gums. You can see that afterwards. But here, as already the topic is getting too much long, I'm going to finish it by saying some of other words. Smoking cessation has become mandatory for you, so you have to quit smoking immediately. Patient says that I am not able to do that. Then you may give the solution. So if you find it difficult, then I'm giving you some solutions for that. You can take nicotine gums whensoever you have the urge of smoking. It will definitely help you. Apart from that, our hospital has some smoking cessation programs, and you can enroll in that. So you can find many people who have already quitted smoking or who are going to quit smoking. So that will help you a lot. By doing all these things, you will be able to lead a healthy life. Hope to see you in a better condition. I'm going to set an appointment with you after 15 days. Are you comfortable with that? Patient says that's okay, fine. So let's see you in a good condition. Thank you so much.